A very good morning to all of our viewers. Welcome to the Mojo Story, the digital platform that does a deep dive into the issues that mainstream media often ignores. On the program today, we're talking about, I think, what really matters to every single person across the world. The COVID vaccine rollout has begun in major parts of the country. India is awaiting its own clarity, even as several production firms, pharmaceutical companies ask for emergency use clearances from the government. But meanwhile, in the United Kingdom and the United States, the Pfizer vaccine is first off the block. Pfizer, of course, is now claiming 90%, 95 or more than 95, close to 95% efficacy in its use of the vaccine, while at the same time telling people that those who have a history of serious allergic infections would be advised to not use this vaccine. There are a slew of other manufacturers, other vaccines. For you and me, lay people who are not doctors, it is almost impossible to make sense of the key question: which vaccine is right for me? Could there be different vaccines that are right for different countries? If you already had COVID, should you be taking the vaccine? And then that famous conspiracy theorist question: has herd immunity come before the vaccine, or will it? To answer all of this and where the world stands in our battle against COVID, we're delighted to bring back to the Mojo Story platform one of the world's top experts. We all know him from Twitter. He is quite literally tweeting, as he says, from the COVID front lines. Dr. Faheem Younus, super hit the last time we had him, really a people's doctor, very patient, answers the most tedious questions that people put to him on Twitter again and again and again and again. And so it's great, Dr. Saab, to have you back on the program. Let me start by asking you the big question. The Pfizer rollout is beginning in the United States. It's already happened in the United Kingdom. If you had to step back and take a look at the big picture, what would you say? Where do we stand today?
Thank you very much for having me, Barkha. If I was out in outer space for the past 5 years and I just come back to the world and you told me, look, we had a pandemic this year, I'd say, all right, no big deal. We in the infectious disease community always knew one was going to happen. But then if you told me that within the same year, we also have 2 vaccines, I would be shocked. I'll fall out of my chair. It is unbelievable triumph for mankind. So I think we who understand what it takes, we are extremely happy about it.
Those are big words, right? Unbelievable triumph for mankind. And it's also the first sort of clear, lucid, good news claim that I've heard ever since I've been reporting this pandemic. I'm then assuming that you believe that the worst is in a way behind us now that we have these vaccines within grasp.
Said it over and over again. I think if this was a one-day match, I feel COVID decided to bowl and really, demolished us in the first innings. I do feel like it's the end of that first innings of the 50 overs, and now it's our turn to come back with the attack. So if all of us work together, which means vaccine is just one part of it, we still have to do social distancing. We still have to be careful with our phased opening of the economy. If we do all those things right, yes, in 2021, chances are that we will be in a much better place. Now we feel there is an end to this thing. If you asked me the same question 5 months ago, we couldn't even see the end.
So I remember, in fact, I was talking to you, a couple of months ago, and you were not that optimistic. And to hear you now borrowing from cricket, I mean, you've done all Desi Sprout. But if you were to stick to the cricket metaphor, cricket is known to throw up surprises in the last few overs. The game can change. It isn't over till the last ball is actually delivered. Are there things that could still go wrong? And I ask this because Pfizer, for example, has issued a sort of health warning to say that if you have a history of severe allergic reactions, you are ill-advised to take this vaccine. Now, that could be anybody. Like, I read that and I was like, oh, I'm easily allergic. What does it actually mean? And in the United Kingdom, there are reports of Bell's palsy that have developed in about 4 people who were at the front line who took this vaccine. So, staying with cricket, could this match still turn?
Absolutely. So I'm glad. Let's stay with cricket because you're right. I think There are so many things that can go wrong. So it's a cautious optimism. That is why I said we still have to all work together. So even though it's our turn, we have to bowl well, we have to field well, we cannot miss runouts and catches, because that's how you're going to lose the match. And what I mean by that is the following: allergies, you already heard about it. Uh, so I think it's overblown, honestly. I think one or two cases, and they are now talking about anaphylactic shock. So if you have a peanut allergy, if you have mild food allergies, if you just get a rash here and there, I don't think there is any concern with that. But if your eyes swell up, if your lips swell up, if you have that sort of an allergy that puts you in a hospital, yes, then the chances are, at present, they're saying you should not take it. I do believe with every passing month, if things go well, more and more people will build the confidence. What else can go wrong? Realize before this COVID vaccine, there are cases of Bell's palsy happening in every country every day. Let's pick a number. Let's say in India, every year, 10,000 cases of Bell's palsy happen. Now, what's going to happen this year? Just by sheer chance, someone who was going to get a COVID vaccine 5 days ago and was going to get that Bell's palsy for whatever reason anyway, will now get the Bell's palsy and will make this correlation, and they'll blame the vaccine, right? Because now there is an external variable we are adding. How we handle those things with emotion or with science is going to determine what kind of trust we establish in this vaccine. Number three, just the access of this vaccine. Moderna and Pfizer are expensive vaccines. They are very limited in supply. We're not going to be able to get them everywhere in the world. So that's another big glitch. Number four, at least these two vaccines require ultra cold chain, minus 20 to minus 70 degrees. And mRNA is extremely sensitive particle and can disintegrate. So are we going to have those kind of refrigerators? These are very special freezers. We had to get four for our own hospitals, and it was not easy. I'm sitting here in the United States. So there are many factors that have to all line up for us to be able to win this match.
I'm glad you've flagged those sort of health warnings, as it were. But let's talk about the cold storage sort of requirement of vaccines like Pfizer and Moderna. Many people believe that given that sort of cold storage that is required for these vaccines, they actually are not suitable for countries in my part of the world, where I'm sitting right now, Delhi, or from Pakistan, which is your ancestral country. I ask this because are there going to be different vaccines that are appropriate for different subpopulations? And if you break it down further, if I'm an individual and I can in fact access all of these vaccines once they're available, how do I know which vaccine is right for me? Am I going to go to a doctor and say, hey, tell me there are 6 vaccines available? On what basis does my doctor tell me which vaccine I should get?
Because I think that's very unlikely to happen. The supply and demand of this vaccine is going to be such that I don't foresee before the end of 2021 anybody being able to pick a vaccine. Chances are you're going to have one vaccine available in your country, in your area, and you're going to end up taking that or not taking that. Those are the overall odds. Of course, exceptions aside. If you're a very special person, you have access to 6 different vaccines. I'm not talking about you. I'm talking about the man who, sells bread on the corner shop. That's number one. Number two, your other question was, remind me again. You asked the first part of this question.
Would there be different vaccines that are
Yes.
appropriate for different countries?
So, of course, I completely agree with that. I think the adenovirus vector vaccines, because they don't have mRNA, they are not as sensitive to temperature, the Oxford vaccine or the Sanofi Pasteur vaccine, which got pushed out a little bit. But I believe many of the vector vaccines, and the Chinese and Russian vaccines are also vector vaccines, they require a regular refrigerator. Are they going to be just as effective or maybe a tad bit less? We don't know. Chances are they may be a little less effective. Instead of 90%, perhaps 70%. But I still think it's not the vaccine that saves people, it's vaccination. A vaccine is no good if it can't get to my arm or your arm. So access is the key. Otherwise, that last mile of the bridge, you build a 100-mile bridge, and if you build 99 miles, that bridge is no good because that last mile, the car cannot just get to the other side. So access is just as important. And I believe that these governments in resource limited countries, they're very smart. I know they understand those infrastructure limitations, and that's why they will be going for products that they can very easily then make accessible to the masses. So I agree with you. I think the Moderna, the Pfizer vaccines may not be the best candidates for the developing world for those reasons.
They're also more expensive,
They're
right?
very expensive, correct.
So I'm going to get to what's better for our part of the world in a moment from now, but I want to start taking some of the comments that are coming on our screen. Salim Bikanerwala says, "This is indeed, Dr. Saab, a triumph of the human spirit. It shows us what we can achieve when we collaborate rather than when we have unproductive competition." And then there is a question from Panjeta who says, "Please tell us about the long-term consequences of the vaccine on the human body." Now, you've already alluded to the fact that this entire paranoia about allergic reactions is understated, that we actually don't know if people are joining the dots where they should. But there's been a lot of fear, for example, about whether pregnant women would be able to take these vaccines, whether they cause infertility. I've seen some of your tweets addressing some of these issues. What do we know in terms of how these vaccines are playing out in their side effects and their consequences? The vaccines are also different. I'm going to say this in a generalist language, so please do correct me if I'm wrong. But from what I understand, some vaccines are going the conventional route, which is basically to give you a weakened version of the virus itself. And the others are actually injecting proteins in your body that will trigger an immune response. This is very broadly how I've understood the two approaches to the vaccine. Like I said, please correct me. I'm just a journalist. What is the difference in how these two kinds of vaccines can play out in terms of impact on the human body?
Yeah, so I'm just making notes along the way so I don't have to ask you again and again, but I'm keeping track of the questions. First of all, completely agree. I think it's a triumph. And yes, magic happens when we all come together. And this is one great thing out of this pandemic. I hope it sticks with us, it stays with us, that these friendships, this humanity that we all have now discovered about each other, we can progress in that. That's number one. Number two, pregnant ladies were not a part of this trial. So currently, I would not advise it to anyone. However, I project that by the time we're in May or June of 2021, you will have over 100 million people gotten this vaccine easily, if not more. And by that time, if there are no other side effects, and if you're seeing a dramatic increase or decrease in the overall pandemic, I think more people will become comfortable, and it will get broader and broader. And younger children, younger adolescents, 12, 13, 14-year-old will start getting the vaccine, and probably some pregnant ladies will choose to get the vaccine. The key point is this. It's on safety. If people forget everything, just remember this one point. This is not a zero-sum game. You are not safe here and risky here. You have to compare this risk with the other risk. That's the question. COVID's risk versus the potential vaccine risk. And I say potential because COVID's risks are very real. I'll tell you just US. In America, we're having nearly 200,000 new cases a day. We're accumulating 1 million patients cases within 4 to 5 days. That's the real risk. We have 100,000 ek lakh maris in the hospitals every day. We have 2 to 3,000 people dying every day. Now, this is not potential or hypothetical. These are the facts today. Now, you have to compare the risk of vaccine against this. And every country, every individual has to do that. So remember, not taking a vaccine is not safe. You're just comfortable with one risk. That's number one. Number two, the risk of infertility, the risk of all those other things, that's complete hocus pocus. I don't think people should even spend 1 second on something like this until you see something in a medical journal. I have not seen anything. Therefore, I'm not going to fall for these conspiracy theories. And these are distractions. They take away your time, they take away your mental space. And I think a lot of people have gotten really good with moving away from this kind of noise and just remain focused on what matters. Now comes the big question, which is the risk, the long-term risk. And I got to explain this to the people because I think if you go back 20, 30 years, this thing was not existent. Nobody doubted vaccines when I was a child. Did you, when you were a child, was there any doubts about vaccine? Right? We don't remember that. So where did it come from? In 1998, there was a paper published in Lancet where children received the measles, mumps, rubella vaccine, and afterwards they started showing some signs which were looked upon as autism. Now, everybody knows this is important, and I'm going to tell this story so people can understand, dissect it. We are talking about 30,000 patients in Moderna trial, 45,000 patients in the Pfizer trial, millions getting vaccinated by next year. Let me ask you a question. Anyone can guess how many children were in that trial? 12.
I have no idea.
12. 12 बच्चे थे.
Well,
It was not 12 million, 12 children. And when they later looked into it, there were ethical concerns. Those parents had already sued the vaccine companies. The lawyers who had sued the companies had given money to the scientists who published that research in Lancet. And that research has been debunked. Lancet rescinded, actually retracted that study 12 years later, which is historic. Medical journals typically don't do that. And reams of literature has been written on it since then, showing that the vaccines are largely safe. And I'll give you one more data point. In the past 10 years, 1 billion children in the world have been vaccinated. 1 billion, right? And each one of them has received 4, 5, 6 different vaccines. So 6, 7 billion vaccines. Think about it. How many, God forbid, how many long term side effects are we seeing? Literally very non existent. So the risk of vaccination is typically 1 in a million. It's nothing compared to what COVID does to us. The risks of infertility and all of that are just hyped up stuff.
but because you have brought up the anti-vaxxers, and by the way, they do exist. I have friends in India who are anti-vaxxers. So this is not actually outer space aliens that we're talking about. I'm sure you know people who make a very passionate argument saying this is all just some big, giant pharmaceutical conspiracy. And a lot of people have pointed to an interview given by a person who used to head Pfizer, who basically said, and I'm sure you've seen that interview, that hey, the pandemic is actually over. The vaccine has come after the fact. You don't need the vaccine. And there are a lot of people who do believe that herd immunity will come or has come already before the vaccine will or has. How do you respond to that sort of anti-vaxxer lobby that basically says this is too late for the vaccine? The pandemic is already in community transmission. People have already developed population immunity or herd immunity, and therefore the vaccine is now useless. And by the time it gets to large sections of the population, beyond the frontline workers and beyond the elderly, it will be fully redundant.
Yep. So one of the mantras I now live by that in the age of information, ignorance is a choice. What I mean by that is I don't argue with those people. My job is not to convince anyone. My job is not to persuade anyone, even your viewers today. Ladies and gentlemen, I'm not trying to persuade you. I'm trying to inform you. I trust you that in the end you will make the right decision for yourself and your family. I'm not a Pfizer rep. Nothing changes for me. Actually, I always joke about it that my job is to eliminate my own job, right? Because if we do a really good job as infectious disease people and you don't get infections, I don't get to see patients, right? So, number one, if somebody has made a choice to remain ignorant, that's their choice. There is no way I can change their mind. Number one. Number two, whether you are the head of Pfizer or you're the vice president, that's still an anecdote. That's not data. Show me data. I respect you, right? But that's not a study. And number three, people who think herd immunity is here, the numbers, of course, vary. Herd immunity is a very complex topic. It's just like in major cities, there are, and I'm sure, like in New York, in Baltimore, where I live, in Bombay, there are certain areas where crime is high. There are certain areas where crime is low, right? Everybody knows that. You try not to go to that place at 1 a.m. Now, herd immunity sort of works the same way. There will be pockets in your cities where your seropositivity is probably going to be 50 or 60% in the slums of Mumbai. But you can't say that the whole city is now safe or the whole country is now safe. WHO's projections are that about 10% of the world is so far infected by this virus. Sweden is a country that tried to go down the path of herd immunity, and look where they ended up. They have very clearly accepted that that's not the way, it's not working for them. An example I give for herd immunity, if if you have a forest fire and 10-15% of the forest is burned, and you say, you know what, no need for firefighters, let this fire just take care of itself. It's not going to take care of itself until it burns 70-80% of the forest. And can we? So of course herd immunity will happen. What will happen? It will probably take 3 more years like the one we are going through. Same level of devastation, just multiply it by 3 more years. If you want to go down that path, your choice. I'm not going to push you.
Let's get to some of the questions on our stream. I think you've pretty much closed that debate, or where you stand on the herd immunity debate. I see an interesting question from Vivek Raman, and I think there's merit in that. Why is the Pfizer vaccine, and in fact the Moderna vaccine too, so much more expensive than some of the other vaccines? Is it because it's better than the others? What are the broad differences between these vaccines? And I think pricing is a very important issue, right? Because it speaks to people not understanding why a different value is placed on vaccine A compared to, let's say, vaccine B.
So if you followed me on Twitter, you know that I will tell you the way it is. I don't know. That's the simple answer. I don't work for pharmaceuticals. I am a clinician who works on the front line. We are almost baffled by this pricing, not just in the vaccine, but even in drugs. Something as simple as doxycycline that used to be $1 or $2 10 years ago here in US, they hiked up the price more than 10 times. So how the prices are set, why the prices are set that way, who has what kind of profit margin, I'm not an expert on that, honestly. I like your question, but I think we need to go to someone who's smarter than both you and I who can answer that question.
But could you elaborate on why you're baffled by the pricing?
I am baffled by the pricing because, see, I'm a little bit of an idealist. I think it's good to have that kid alive in you, no matter how old you are. As great a triumph as vaccine is, an even larger triumph would be an equitable distribution of this vaccine. So if you ask me who's going to be the real heroes are going to be the ones who are going to say, look, we're not going to take any profit and we're going to make this vaccine accessible. Case in point, Jonas Salk, the inventor, I would say, the discoverer of the polio vaccine. This is the story, what inspires me. In 1953, when the polio trials were happening, do you know who Jonas Salk gave that vaccine to? It was not approved, it was still in trial phase. He gave it to himself. He gave it to his boys. He gave it to his wife. His own lab technicians took that vaccine. That was his confidence, and that was his way of walking the walk. That I'm not going to put you on any risk that I'm not going to take myself. And within years, just in US, the number of polio cases dropped from 45,000 to 900. And guess what he had? He had an opportunity for business. He could patent that vaccine. And he decided not to do that. He was a son of Jewish immigrants, the first son to go to college. Money must have been important for him. But he said, no, I want this disease eradicated. Don't patent this vaccine. So I'm looking for heroes like that emerging out of this pandemic. And I'm not saying it's a fair, equal comparison because I don't know the details, but the AstraZeneca Oxford vaccine, at least what I read, they have made a very public commitment that they will not be charging any profit. And they will be making over 1 billion doses to give it to many impoverished countries through WHO. What happens down the road? Who does that more than others? Canada recently made a pledge that whatever extra vaccine they have, they will be giving it to the developing world. So that is what inspires me. But yeah, like business has not died. A lot of people, and it's not just the pharmaceutical companies, unfortunately, a lot of people have looked at this pandemic as a business opportunity. We all know that it exists all around us, and that's the sad reality.
Would it be fair to say that you think Pfizer and Moderna, on the face of it, seem to be more driven by profit making than AstraZeneca, from what you understand from afar?
Honestly, I have no idea. I don't know what their expense and what kind of expense, what kind of investment decisions they've made, what kind of risks they've taken. So right now, I'm giving everyone the benefit of doubt, and to me, they have all done a masterful work. So it's too premature. I'm not going to judge anyone. I will tell you what inspires me, but not the other side.
So, I mean, it is fair to say that you don't know what the basis of the pricing is. And I think it would help the pharmaceutical companies to actually come out and tell
Yeah.
people why their vaccine,
Mhm.
in particular Moderna and Pfizer, compared to some of the vaccines that we're seeing being worked on in the developing world, why are they more expensive? Like, actually, nobody really understands that science. I want to take another interesting question from Sanchit, who says, would the vaccine be mandatory or optional for the citizens? Now, right now, of course, Dr. Younus, there aren't enough vaccines for everybody, right? But it's an interesting question. Given that how we travel, our world getting back to normal, to a post-COVID normalcy, is going to depend on the scale and efficacy of these vaccinations. Do you think that governments would move or should move towards making these vaccines mandatory?
Yeah, I think governments should never move towards making it mandatory. It's a much longer ethical debate, but I'm very clear in my mind. I think my experience says you inform people, you educate people, and then you trust people. You are going to have a much better, and this whole notion of developed world, developing world, education, democracy, autocracy, this is also a little bit overblown in my mind. I think basic humans, we are all the same. We are all driven by our own safety, the safety of our children. It's just good messaging. We need to give very clear, honest messaging to people. Now, that does not mean that private sector cannot or will not mandate it. Case in point, Qantas, I think Australian airline has already come out and they started talking about that in their future, they will demand vaccination proof from anyone who wants to take an international flight because that's critical to their business. I think you will see more and more of this coming from private sector. But if I were to advise governments, I would say spend all your energy on good messaging and don't go towards mandating it.
The next question, is the vaccine for everyone? Individuals of all age groups, pre existing medical conditions. Now, I know you already said that as of now, because pregnant women were not part of the trials, we do not have enough data points to advise those who are pregnant to take it now. Maybe in May we will. Are there any other conditions in which you would say, hang on, don't take the vaccine? It might be better to go through that 10 days of a moderate to mild COVID infection than to actually take the vaccine given your medical complications. I mean, are there any circumstances in which you would say getting COVID is better than getting the vaccine?
No, I would say children under the age of 12 and pregnant ladies are the only two groups. And by the way, I don't think that vaccine is going to be dangerous for them. My hunch is that it will be safe for even those two groups. It's just going to take us some time to get there. But I don't think anybody else, if we had 8 billion doses today, yes, you want to be very safe and you want to still roll it out in a safe manner. But unless more data shows that it does not help or it harms someone, I think everybody should take it. Now, it is possible that if, let's say, you're 80 years old, you're on cancer chemotherapy, and your own immune system is so shot, it's possible the vaccine may not protect you as well, but it's not going to cause more harm to you. So I think if you're elderly with underlying conditions, more of a reason for you to take the vaccine because God forbid, if you got the virus, chances are you'll have severe disease.
Let me go to my next question. Let me just find it again now. Okay. Will COVID-19 remain a time-bound pandemic, or do you think it will be endemic like polio or chickenpox? I think that's an interesting question, and I'm guessing you're going to say we don't know, but maybe you do know something that we don't know yet.
Again, I think scientifically the accurate answer is we don't know, but I do have a hunch based on 25 years of my experience. I think it's a respiratory virus. I think it will become irrelevant. It probably will never go away completely, and that does not, that's good enough. Because if it becomes like other coronaviruses that are in our system, there are six other coronaviruses, and I've treated many of them. They don't crush economies, they don't dominate the news, they don't put
Yeah.
airlines out of business, they don't flood your hospitals. So that's an irrelevant coronavirus. So in my opinion, the end game here is not to eliminate it like polio. The end game is to make it irrelevant, and that will be great for all of us. And I think we are very likely to be able to do that.
The next question from Sushil says, why are multiple dosages required? And what about the mean period between dosages? And I think this is a very interesting question. Nobody quite knows, is this a one-time vaccination? Do you need it a few times a year? Do you need a booster shot? Do you need some vaccines more than once? And if you take the other ones, then maybe not, and a single shot is enough. And it's all quite befuddling, Dr. Saab.
Yep. So going back to cricket analogy, if you were to go up against a new Australian fast bowler, the more you see that bowler, the better it is. If you're a batsman, right, you want to play that bowler a lot in the net practice because the more balls he throws at you, the more you're able to figure him out. And that's what our immune system does. When you give the vaccine the first time, it sees the virus, it starts building antibodies, and it has a memory. There's like a surveillance camera. So it takes a picture. It said, okay, now I will remember it. In 3 or 4 weeks, when you bring that virus again, or the particle, in this case, the mRNA, and the spike protein is produced once again, now the immune system has seen you twice. So the second time, it's going to make a more robust antibody response. It's going to have a better memory. And now it's going to last much longer. So if that memory, memories fade away. So the more you see something, your memory is now going to be stronger. So chances is with a booster shot, as we call it, at 3 or 4 weeks, we don't know today, but our projection is if one shot is going to give you immunity for 6 or 9 months, two shots are likely to give you immunity for 1 or 2 years. So two shots are better for that reason. The strength of immunity and the duration of immunity is likely to be going to be longer with that booster shot.
Fascinating. And then there's another comment on our screen, Dr. Younus, that actually says the access to vaccination is going to show the true color of equality in the world. Now, I think what I want to understand from you is, are countries morally obliged to, at this point, obviously their first priority is to their own citizens, but at some point, are companies and countries morally obliged to share science at this point?
Yeah, again, I think if you go back, how did we even get here? Because the scientists from China put this genome free online on a website in the early part of January. Were they morally obliged to do that? They knew that you would not be able to develop any test unless that viral genome gets out. You were not going to be able to design your vaccine candidate. But someone did it, right? Was Jonas Salk morally obliged not to patent that vaccine? So, unfortunately, we live in a world where these big words about morally obliged, I'll be real with you. I think we have double standards. I have a different standard when it's on me, when I'm the giver, and I have a different expectation when I'm the taker. So unfortunately, I wouldn't forget about the vaccine. I think just look at what is in my domain today. Am I really morally as fair to people who are working for me, those who are under me? I mean, so this is a very big philosophical question. In ideal state, I would say yes. I think we are all morally obliged. If you ask me, the short answer is we get happiness by taking, but we get fulfillment by giving. So it's always good to give. I think I'm fully driven by that. I think it will be awesome to see that.
You're still driven by idealism. That's good. People on the live stream are taking us back again and again to side effects. You did address them in the beginning, but because there's so many questions on it, I'm going to pick up another one. What are the chances of the vaccine throwing up surprises, unforeseen side effects? What worries you? Given that given that they're going to be administered on a few thousand people for less than 6 months, what do we not know right now? What worries you? What would still keep you up at night?
Yep. So I think nothing, honestly. I'm sleeping really well. So the point here is realize between Pfizer and Moderna trials, 35,000, there were over 70,000 people in those trials. Let's say half of them got the placebo. The other half, more than 35,000 people have gotten this vaccine, number one. They're doing well for more than 2 months now. Some people think 2 months is not a long enough time. Well, you don't understand vaccines because 99% of side effects of a vaccine are going to happen within those 2 months. That's why 2 months is accepted by FDA. It's not an arbitrary number. So it's a very big deal. Now, what it means is yes, can things change down the road? Of course they can. If something happens only in 1 in 50,000 cases, you're not going to see it now. You're going to see two cases once you reach 100,000, right? And then you're going to see 20 cases once you get to a million. What will happen? Then we will stop, we will reassess, and we will change course, right? So this is how science works. You keep an open mind and you continue to calibrate. But we cannot, again, what I will say is every day that goes by, thousands, 9 to 10,000 people are dying of COVID in the world. That's what we are up against. So, should I take that risk and do nothing? Or should I start with something which is unprecedented and continue to reassess every week, every month? Just because vaccine is approved doesn't mean that we lose oversight on this. There will be very strong oversight on this vaccine for the next year. And by the way, all vaccines. And we will change course if need be.
One of the questions that comes up again and again is about reinfections. And I know from your tweets, from our previous conversation, that you think this is an overstated case, that reinfections are an outlier event. But what people do not know is what they should do if they've already had COVID, especially in relation to the vaccination. So let's take this particular family on our screen. My entire family is COVID positive. I'm living with them. I've already contracted COVID in early June. As of now, I have no symptoms. Do I need to get tested again? Do I need to get vaccinated? What happens to those who did get COVID this past year? Do they need to get vaccinated? Should they get vaccinated? And what do we know about reinfections?
Great point. So we don't know whether they should get vaccinated. I think currently, ethically speaking, I think it would be, if they had a choice, I would say wait it out and let others get the vaccine because you have some immunity. Chances are pretty good immunity. So that will be just my own opinion. This could be right or wrong because it's not scientifically proven yet. But the issue of reinfection is rare. That is why I keep saying if you had COVID once, you probably know what it does to the human body. Just respect the virus. Don't fear the virus. There's a difference between the two. When you get paralyzed and you don't leave your house and you don't let anyone come inside your house and you're wearing gloves and you're paranoid, you're afraid of the virus. That's a bad strategy. What I want you to do is respect the virus, which means wear a mask, maintain social distancing, and keep washing your hands. Even if you had the virus, keep respecting it for now. And in another 6 to 12 months, you're going to be out of this forest. In that period, if you get reinfected, the chance is very, very small. Current numbers suggest that risk is less than 1%. Everybody has their own risk tolerance. My advice would be just don't let your guard down.
You had a tweet on your stream that made me laugh, and you said that people, or rather men who say you don't need to wear a mask, are like men who don't let other people speak. So mansplainers and the anti-maskers have something in common. But there's all kinds of questions for the world right now beyond the vaccination, right? I think one of the things you've said is that you cannot keep people locked away from each other for an indefinite period of time. So the CDC can go on saying that dining together increases your risks of contracting this infection. But I think human beings have reached a point where they cannot live in lockdown anymore. Given that, and given that the vaccine is still a way for a significant chunk of the population to get it, what should people do in the interim?
Yep, same thing. Respect the virus. Look at it as driving. What do? There is a risk for accident every day. But if you're drunk, you don't drive. If you're sleep deprived, you don't drive. When you drive, you put a seat belt on. You stay within the speed limit. You keep safe distance between cars. You know where I'm going, right? So that seat belt is like your face mask. Wear a face mask. That distance between cars is like your social distancing. Learn to live and adapt to this lifestyle. And I'll give you something that may give you hope. There are about 6,000 aeroplanes that are flying in US alone, just in America, every day. 6,000 aeroplanes. You cannot be more cramped than an aeroplane, right? But how many outbreaks have you heard coming out of those aeroplanes? Almost none, which proves that masks work, that social distancing or hand hygiene, and when people are careful, these outbreaks will not happen. So my request is don't be paranoid about surface contamination, about newspapers and dollar bills and dudwala and dahiwala and your grocery and your vegetables. You don't need to steam any of that. Don't worry about that. It will take away a lot of pressure. Learn how to do video calling with your loved ones on WhatsApp for instead of reading all that junk on WhatsApp. do multi-video calling, 5, 6 people at the same time and have lunch together on WhatsApp. There are people there. Those are the kind of things you can do, and just continue to respect the virus. Don't be paralyzed.
There's a question that asks, is there a possibility that pharmaceutical companies will come up with an updated version of the vaccine from time to time? That there are things that because we don't fully know the science on this, we don't fully know the consequences on this, we are possibly in a space where, and I don't know if this has happened with other vaccines, where this may not be the final vaccine even when it's rolled out.
Yeah, it's a great question. I think there's a difference between vaccines and Microsoft Word and Windows. This is not like Windows that's going to keep coming up with a new update every 6 months. And the reason for that is because you have to take a vaccine through phase 1, phase 2, phase 3 trials. So if Moderna tries to come up with a new vaccine, guess what? They have to go all the way back in the line, get through 7, 8 months of trials and another FDA approval. What will happen though, instead of one or two, every month you'll see one new vaccine getting approved. And 6 months from now, there are going to be so many names that people won't even remember. That's where it's going to end up. Instead of Pfizer coming up with a different vaccine, what is more likely to happen that Sanofi will come with one, Johnson and Johnson will come with one, Oxford will come with one, and the Chinese Russian vaccines, so Sinovac. So you will have a very crowded field, which is a good thing. But I really doubt that Pfizer and Moderna can go back and just say, all right, you know what, this is just version 2. It's going to be hard to do that.
It's a great quote, by the way. The vaccine is not like a new version of Windows. But Sagar has an interesting question. Do you think it would be necessary to, we're back to herd immunity, by the way, which I know you hate, but I think this is an interesting question. Do you think it's necessary to vaccinate the whole population or just a critical mass of the population to achieve herd immunity, including health workers and vulnerable population, to break the transmission? I think there's a reasonable question here, as distinct from the conspiracy theories about herd immunity, right? So how many people does a country need to vaccinate as a percentage of its population to say that, okay, we can break the transmission?
Yeah, so again, nobody knows the real answer, but here's how I would look at it. Because, we Desis are great negotiators. That's what I hear from people. So I'm going to try to negotiate something here. Let's say 10 or 20% of the people have already had the virus. I would say let's just vaccinate another 30 or 40% so we can get to close to 60% of the population. And then you're not going to have any more outbreaks. You'll have randomness here and there, but your schools will be open, your businesses will be open. So you have to somehow get to 60% or above in any country, in my opinion, large or small. I know India is a very large country, you have a huge population, but at the same time, this still human beings. The virus doesn't know that Indian border ends here and the Chinese border starts there. The virus is going to continue to spread. So that's how I would negotiate the two.
This is an interesting question. Who should get it first? And different countries have handled this in a different way. But the convention has been apart from health workers, the elderly. There is a counter view by in India by those like Kiran Shaw, for example, who heads Biocon, who actually believes the working population should get it before the elderly because the elderly are not going out, right? So Hitesh Gupta says, what is your view about whether the vaccine should be given to 60 plus people who have actually not suffered COVID? Should they be in priority or should it be the working population that actually needs to get up and go out, right? This is very interesting.
So I'm a big fan of the wisdom of crowds. I think this is not just a medical decision. This is a medical, economic, and ethical decision. So I'm not trying to dodge a bullet. If you know me, you know that I'm not afraid of questions. I just don't think that I'm an expert in all those fields. I think this will be a great discussion between an ethicist, medical people, economics, and perhaps government. And all of them then need to come together because somebody will have to explain that decision to the masses. I'm big about public transparency and communication. No matter which group you pick, you will have to come out and be able to explain that. And I don't think that burden should be on any one sector.
So you feel that this is more an ethical question than a medical one?
I think it's all of those, right? It depends on because your economy may have different realities. And in Sweden, in Norway, they may be able to just shut down their economy or just send everyone a check for $1,000 for another 5 years. Indian economic realities could be very different. So the pressure on your government to get a 35-year-old out in the workforce could be a very different pressure than Norway. And that is why I say it's an economic question. The elderly, the cost, the life, the family network, the worth of, and I know this is a very strong statement, but it's unfortunately true. What value we put on the elderly can also vary from culture to culture.
I was just going to say that in our part of the world, which is also your part of the world, it would be a completely different approach. Like there is no Desi family I know that would be able to logisticize this and say, "Oh, our parents are at home and we're the ones working, so we'll take the vaccine first." Like it may be logical, but no Desi family will accept it.
Exactly. So those are the realities, and I think we're gonna acknowledge that. As they say, my strategy, my culture had your strategy for breakfast. Strategies don't work. You have to understand the larger culture.
There is an interesting question here, given what happened with the polio vaccine in some parts of South Asia. Sardar Sat says there's always a problem as some people refuse to take the vaccine, as we saw happening with the polio vaccine. How are we going to get beyond these difficulties? I think this may be a question from Afghanistan, it seems, but that's the question. And I just want you to take that because I
So
know we've had that debate in other countries, in Pakistan as well, for example.
exactly. So my suggestion would be don't waste time. Continue to work with those who are willing to take the vaccine. The supply is not that big. You cannot vaccinate everyone anyway. Don't engage, don't annoy people. We'll respect their opinion. You want to do certain things for yourself, and let's get to that decision once we are 6 months, 9 months from now. This is not the time to argue with anyone. This is the time. We are so far away from that 60% mark that there is no point arguing and creating more resistance.
Fair enough. Will there be different vaccines for different strains of COVID-19? I've actually never understood this because no one has ever been able to tell me clearly in this 1 year of reporting the story. Is this virus mutating? Are there different strains of it? Does it change with geography? And if so, do different strains need different vaccines? And how do we know? Because sometimes when I travel across India, I've had doctors anecdotally telling me that we think the strain of the virus is more acute in state A compared to state B. It still seems anecdotal to me. I don't know enough about it. Maybe you can help me here.
So the key word there is we think, right? And that, even though very important emotionally, is not a scientific statement. So just because I think something doesn't make it right. Viral mutations are much more flashier in Hollywood. In virology, they're very boring actually. What happens is every time of every when parents have a child, what happens? The child resemble the parents, but not fully, not 100%, right? When that child has children, they still resemble the parents, but they're still eating, drinking. None of those children fly. They're all human beings. They share common human traits. Same thing applies on these viruses. Every time they replicate, there are some changes in the virus, but those are what we call non-consequential mutations. They don't change the severity of the virus. They don't change the mode of transmission of the virus, and they don't change its how vulnerable it is to a vaccine. So I would say people should not worry about the word mutations. It's a big word just thrown around to sound smart, but in most cases, it does not really will impact the viruses or the vaccine's efficacy.
You did address this in the beginning, but there are going to be lots of paranoid questions about the reports of Bell's palsy. And we do have Siddharth saying, please do speak about the reports of facial paralysis due to the Pfizer vaccine. And I'm bringing this up again because I know in India now there are a lot of people who've been through this virus and they have emerged on the other side. And there are going to be people who will be like, I'd rather just have the COVID. What is it? It's just a heightened version of the flu. And I'm sure you hear that all the time.
Absolutely. And again, I wouldn't, as I said, my job is not to persuade you, sir. If you don't feel comfortable, don't get the vaccine. Just read about Bell's palsy. And what you'll understand is that Bell's palsy is caused by either herpes virus or Lyme disease or sarcoidosis. But the fourth cause is the most common, which is unknown. After hundreds of thousands of years, we still don't really know what causes Bell's palsy. So that's exactly my point. There were cases of Bell's palsy happening every day in our communities. But since we were not adding another variable like a vaccine, we were not worried. You will be prepared to see more cases when somebody will get a vaccine and they'll get some illness, or they will die, or they'll just pass out, and it'll be linked, correlated to the vaccine. Now, how do you differentiate? Two things. When a year will go by, you'll look at all the number of cases of Bell's palsy and you'll compare that with the year prior. And you'll say, okay, in 2019, we had 5,000 cases of Bell's palsy. In 2020, we have 5,100. In 2021, we had 4,900. And then you say the total number of cases hasn't changed. But in real time, it's going to be hard. Unless you see a trend of cases, unless you see a clear spike, then yes. But anecdotal cases will happen. You have to make peace with that. You have to defer and trust the expertise. And if you cannot, then don't take the vaccine.
Next question. What is, and I think this is very interesting because between Pfizer and Moderna, and we've played those graphics in the show, the difference between claiming 95% and 90% efficacy. Anirudh Jadhav says, what is the difference between a vaccine which says it has a 90% efficacy as opposed to a 95%? And is that a substantial difference? And if there is, then don't you think there will be more demand for one over the other? What does it all mean?
Yeah, a great question. I don't think it's a substantial difference, number one. Number two, if you look at the side effect profile, actually, the Pfizer vaccine, which is closer to 92% effective, has an easier acute side effect. The first 1 or 2 days when you can have fever, when you can have body aches, and that goes away after 2 days. Moderna vaccine has a little bit higher. So I think they're very comparable products, honestly. If they were both available, we are getting in our hospital Pfizer, and hopefully within the next month, I'm on the front lines and I'm being asked to be an ambassador and lead by example, and therefore I may get the vaccine. So I don't think that either one is significantly better than the other.
It's interesting that you mentioned that as a healthline worker, your hospital is going to get the Pfizer vaccine. I was actually going to ask you, if you had to choose, is there a vaccine that you would make a preference for as a health worker at the front line? And which one would it be? And has that decision been taken for you, or would that be your own decision as well to take the Pfizer vaccine?
So in US right now, Moderna is going in front of FDA on the 17th. So Moderna is not even approved. It's not dispatched. Pfizer is the only product that has been dispatched right now. So most hospitals are getting Pfizer. Chances are in 2 or 3 weeks, we may have two options. Today, we don't have that option. And yes, our hospital is not mandating this vaccine on anyone, but we as physician leaders have to make sure. And I told people straight up, look, if it's a rationing issue, you want me to be in the end, I'm happy to be in the end. If you want me to lead by example and come in the front, I'll come in the front. I'm fine in both positions. But those are the kind of decisions all of us have to be making these days.
But if you had a choice, which vaccine would you take? And would you take one at all?
I will take, of course, and honestly, I'll take either one of them. To me, it's negligible difference. And again, I'm not thinking individually on this one. I've seen so much pain and suffering with COVID. Last week, I had a patient. She's 70 years old. She's on high flow oxygen, and every day I go to see her, and every day she's neither getting better nor getting worse, and she's alone. And all COVID patients are alone in these hospitals. They don't have a family member by their side. They don't know whether they're going to get on a ventilator in the next 3 hours. It's very, very painful to see that day in and day out. So
Yeah.
I cannot dissociate myself from those realities. My focus is really on larger public health. I'll take whatever everybody else will take.
There's a question about Chinese vaccines. It's a bit simplistically put, but I bring it up because Peru just halted the trials of the China vaccine. We don't quite know why. And Saptarishi is asking, are Chinese vaccines reliable? And there's so much global sentiment against China right now because of the origins of the pandemic. But I know you to be someone who can disassociate emotion from science. What do we know about the China vaccine?
I mean, look, I'm sitting in America. The 2009 and 10 H1N1 originated in America. People didn't blame America. So again, I want to dissociate from that, number one. But Chinese vaccine, it has not completed its phase 3 trials. That's the main thing. I have not seen a published report of their 30, 40,000 volunteers getting that vaccine in a randomized placebo control fashion. So we have not seen that sort of facts. And once those facts come out, we will be happy to make some comments about it. But that's the reason I'm unable to give you an endorsement or a rejection, because we just have not seen anything. It has nothing to do with China.
I don't know if this is correct, but I'm taking it on the screen and you can tell me if this is correct or not. Please speak about the retraction of trials in Australia when volunteers developed antibodies to HIV. I had not read this. I may have missed it. Have you seen it? And what sense do you make of it?
Yeah, same thing here. I've just seen the headlines, honestly. This is the new reality these days when, news is ahead of me. I have not gotten deep into it. I don't know much about it yet.
What happens if someone gets COVID even after taking the vaccine? What would you say then? What does it tell us? And that's a great question, I think.
Great question. 90% efficacy means there is a 10% chance, right? So you should prepare for that. That is why we say, even when you're vaccinated, don't stop wearing a mask, don't end your social distancing, because that means if 1 out of 10 people are still going to get it, 90% is not 100%. So, and I also have another hunch. I think clinical trials have an artificial environment where patients are tracked, where people who come and enroll for a clinical trial are usually those who are very disciplined. They have a certain personality. Anytime you take a drug or a vaccine outside of a clinical trial, usually efficacy actually goes down a little bit. So I will not be surprised if Pfizer and Moderna products are maybe 80, 85% effective in real life, which means 20% of the people will end up still getting an infection. Now, we don't know whether they will get a milder infection, but I will say it's a given. You should not be surprised about it. It will happen. That's exactly what 90% means.
Salim Bikanerwala says, according to the good doctor, how long would it take for 60% of the world population, or let's even say a country's population, to be vaccinated? And obviously, we've picked up this 60% figure because it's the figure you gave us. You said every country needs about 60% of its population vaccinated before it can talk about population slash herd immunity. Now, we don't have enough vaccines to go around, right? Not right now. We don't have that manufacturing capacity. So what time frame are we talking about? One. And two, surely we can't stop living up until then. So would you say mask up and get on with life in the meantime?
Yep. So I've been saying that all along. I think mask up, have social distancing, respect the virus, and get on with the necessary parts of life, right? There's a difference between necessary and there's a difference between having a wedding with 800 people, right? So this is where we may disagree and you may not like me because I don't find that necessary. I find it very important for those two young people to get married or old people to get married and be able to move on. But guess what? Invite those 800 people next year or 2 years later, but not today. So to me, that's not necessary. But you start with your fundamental work today. To your other question, I think the way things are, it's a matter of years. I came to 60% because mathematical modeling, the lowest number for herd immunity that I believe is about 50%. Traditional teaching was 70%. So I'm just evening it out at 60%. But as far as how long it will take, it will be different for different countries. It surely will not be in 2021. It's going to take much longer than that.
And therefore, I mean, I'm a big votary like you of mask up and live, because we just can't not live anymore. Just live with the new culture of wearing masks. And, we have 2 minutes left. So let me take a last question. There's Anjan here who says that given that you've said that 10% of the population mathematically could still get the COVID because, 90% efficacy to 95% efficacy, how prepared then are we with curative medicines for COVID? Is our pharma ready? Because the guys who still get it, those of us who still get it despite the vaccine, are going to need treatment. Treatment right now is kind of trial and hit and miss. I think you had a swipe at those on your Twitter feed about the hydroxychloroquine propagators. It was all in good faith, maybe. There have been all kinds of rumor mongering about what medicine to take. And even now, the doctors have got better at treating it. There's no one set of prescriptive treatments. So what happens to those who still get COVID after the vaccine?
Yep. So two, three parts of the question. I do look at it differently. I think there is a very clear protocol for treatment now. It's a matter of whether we want to adopt it or not. Even doctors, we're not all the same. Some of us are very hard-headed. So that's one thing. I think the protocols are now much, much clearly developed. There is less argument about that. Number one. Number two, if you reduce the total number of cases, once you reduce the total number of cases from growing by 1 million a day to, let's say, 1 million in 3 months or 6 months, treatments are not that important anymore because the magnitude has changed significantly. Remember, COVID's mortality is still less than 0.5%. 99.5% people will survive this infection. The difference only is 99, 1% or 0.5% of 100 million is going to be 500,000, right? So our job is to just reduce the total number of cases. Once the total number of cases, if 60% of the people are immunized and the other 10 or 20% had COVID before, I think you're going to be in a place that this virus will not be able to find the transmission chains as efficiently, and it'll become irrelevant. I don't think that finding a treatment is as necessary anymore. What is important is get vaccinated.
Okay, in the end, there's a call for you to speak in your local language. I don't know what local and global is if in the world we live in, but Sardar Saad says, Dr. Faheem, you're a local boy. Can you deliver your language in the local language? We need awareness. You can do that for the subcontinent. तो आप आखिर में फहीम साहब, जो लोग उर्दू, हिंदी, पंजाबी समझ पाते हैं, उसके आगे तो मुझे भी भाषा नहीं आती, आप उनको क्या एक संदेश देना चाहेंगे, क्या मैसेज देना चाहेंगे? आप पिछली बारी आपने आई थिंक गालिब को कोट किया था, क्रिकेट को कोट किया था, इस बारी अगर आप एक आखिरी मैसेज छोड़ना चाहते हैं साउथ एशिया के लोगों के साथ, तो वो क्या होगा?
वो यही होगा कि वायरस का एहतराम करें, इससे डरने की ज़रूरत नहीं है। और एहतराम का मतलब है कि आप मास्क पहनते रहें, आप गैर ज़रूरी बड़ी बड़ी महफिलों में ना जाएं, आप अपना डिस्टेंस रखें लोगों से। जब वैक्सीन आए उसके बारे में पढ़ें, उसके बारे में सवाल पूछें, अच्छी बात है। लेकिन अगर आपका डॉक्टर आपको ये कहे या आपकी हुकूमत या आपको कहे कि ये वैक्सीन लगवा लो, तो आप वो वैक्सीन लगवा लें। और इस पैंडेमिक में जो हमने लेसन्स सीखे हैं कि हम एक दूसरे के करीब आए हैं, हम में कुछ इंसानियत आई है, कुछ हमें थोड़ा सा खौफ आया है, कुछ हमारे गुरूर नीचे आए हैं। वी अंडरस्टूड कि वी आर ऑल सो फैलेबल, हम कितने कमज़ोर लोग हैं। उन लेसन्स को हम ना भूलें और ये फिक्र ना करें कि ये पैंडेमिक हमेशा के लिए रहेगी। हमेशा के लिए कोई बुरी चीज़ नहीं रहती, ये ख़त्म हो जाएगी। आप अपना हौसला रखिए, उम्मीद में रहिए। और गालिब की बात हो रही है तो वो फिर गालिब ही को मैं आपको सुना देता हूँ कि रात दिन गर्दिश में है सात आसमां, हो रहेगा कुछ ना कुछ, घबराएं क्या।
Thank you, Dr. Saab. It's such a pleasure. We should end on Galib, but देसी लोग क्या होते हैं कि आपने क्रिकेट ले आए कॉन्वर्सेशन में, तो लाइव स्ट्रीम में आप सवाल पैंडेमिक से हटके क्रिकेट पे हैं। डॉक्टर साहब से पूछो उनके फेवरेट क्रिकेटर कौन है? I mean, this is what we do. We're that cricket obsessed. But you want to answer that just on a lighter note, so we can all feel better?
Absolutely. बहुत सारे हैं। मतलब ये जो फेवरेट का क्वेश्चन है, मेरे बहुत सारे फेवरेट खाने हैं, मेरे बहुत सारे फेवरेट कलर्स हैं, उसी तरह मेरे बहुत सारे फेवरेट क्रिकेटर्स हैं। They're all over the world. Imran Khan, Wasim Akram, Javed Miandad, Virat Kohli, I mean, unbelievable batsmen. और बहुत सारे हैं, many Indian players. मुझे अब इतना मैं अब नहीं देखता, किसी ज़माने में मैं बहुत देखता था. It is in my DNA, but about 10-15 years ago I divorced cricket. तो वो अब that is the reality. मैं इतना मेरे पास वक्त नहीं होता, लेकिन I do see what's happening. और I mean, it's a great sport.
Yeah. Divorcing cricket to marry medicine. You're a very, very patient doctor, and it's always a pleasure. One learns so much from you. I know it's 12:30 in the morning where you are, so we're going to let you sleep. Dr. Faheem Younus, pleasure as always. Thank you. Thank you for being so patient, and thank you for teaching us so much. Stay well and stay safe. Thank you
for having me. Take care.
Thank you. Bye, sir. Thank you.